So welcome back, Heather, Rayni. How are you today?
Great.
Doing well, thanks.
So this is our second session that we as a group are doing on avoiding pitfalls in ABA billing. So this second session is sort of around some of the high level points with practice management. So our first session, if you haven't seen it, you should go back and watch it. It talks about some of the really early stage tasks and things that you need to do to make sure you're setting yourself up for success from a reimbursement perspective. But this session, again, is on practice management. So Rayni and Heather, why don't you guys do a real brief introduction, and then we'll get started on some of the topics we want to cover today.
I'm Rayni McMahon. I am the founding principal of Virtue Healthcare Consulting. I am a BCBA, but have also had extensive experience in operations and senior leadership at large nonprofit organizations.
I am Heather Hearn. I am the Chief Operating Officer at ZMark Health, and I have been in revenue cycle management for over 20 years, probably 25 at this point. And I've done everything from front office work all the way up to running very large revenue cycle centers, both in behavioral health and physical therapy.
Very good. And I'm Matt Zabolotny. I'm the managing principal of exydoc, which is a credentialing management and software firm. So the topic of practice management is an enormous topic. We're going to try to touch on some of the really key components of practice management today. And practice management is basically all the things that you have to do to run your practice that aren't necessarily directly consumer facing, the actual treatment. This is some of the stuff you need to do to surround that to make sure you're optimizing yourself for reimbursement. So I'll throw this question out. Why is effective practice management so important?
So as we talked about in our first video, having the foundation, having the proper EMR, understanding your payers, understanding contracts, that's first. But second to that is making sure you have your practice management software system set up appropriately. If not, all of the work that you did to begin with will end up either in non-payment or a delay in payment. So having these policies and practices outlined, understanding workflows, understanding who's responsible for them is very, very critical.
Absolutely. One of the most important components of a solid practice management system, if you will, is understanding the consumer's insurance and verifying the consumer's insurance. And there's a lot of different ways that you can do that. But what are some of the things that you guys see as being critical around insurance and benefit verification as you're getting ready to treat these consumers?
So I would say, first of all, when you're looking to schedule, making sure that your front office team or whoever is answering the phone is ready and understands insurance. Insurance is difficult. Like I said, I've been in the industry for a very long time, and it's still confusing. So making sure that the staff that you have understanding insurance is extremely important. Making sure that they have the correct access to payer portals if needed. That's a good way to check eligibility and get benefit information, making sure that they have the correct contacts at insurance companies. A lot of times when you're checking eligibility, you are just making a phone call. It's not like you're calling somebody specific, but making sure that they have the correct phone numbers, you're obtaining insurance cards, all of the relevant information up front. Rayni, did you want to talk about auth and with the frequency?
Yeah, and one thing I would add on the insurance too is making sure that you're asking the families if there's more than one form of insurance, because a lot of times we may only know about one, and that can cause problems down the road with the billing. For the authorization piece, it's really important to understand what services require pre-authorization. So for example, some payers require pre-authorization for assessment and services, and some do not require pre-auth for assessment, and some don't require pre-auth for any of it. So it's really important to understand that with the payers that you're working with, and also understanding the process by which you have to request an authorization. So there's still faxing. We kind of laugh about that we're still faxing things in this day and age, but there's also payer portals that you can use that are sometimes much more efficient and much faster. The other thing that I would add to that is really understanding what forms are required. So different payers have different requirements of what needs to be submitted with that pre-auth request, and just making sure that you're well versed on that for all of the payers that you have. The last thing that I would add to that is understanding how long the authorization approval takes. So there are organizations that have a 14-day window that they can use, and they use every second of that 14 days. And there are others that have the 14-day windows, but might turn it around in 3 to 5 days. So that's a really important point to understand, so you know what to expect once you submit.
Very good. I wanted to just circle back for a second on something that Heather talked about with the verification of insurance, right? So you're going to ask the family member of the consumer, the subscriber, whomever. You're going to ask them for their insurance card. But how do you verify that information is accurate, or maybe they don't have their insurance card, they lost it, or something like that? Are there tools out there that can help a provider to investigate and maybe discover some insurance coverage that the family may not be fully aware of that's out there?
Yes. So I would say specifically in the state of Pennsylvania, but obviously in other states, the Medicaid portal typically gives you a lot of foundational information. A lot of kids who are receiving this service may be dually eligible, so they'll have a commercial insurance, but then they'll also have a Medicaid product. So really starting on the Medicaid portal, you should definitely have access to the portal, looking on the portal and seeing what you can find on there. We all know that sometimes the Medicaid portals or even insurance portals aren't necessarily accurate and up to date, although they should be. So really, when the consumer or patient parent calls for the appointment, you should be getting a copy of the card. It should be a requirement when they're scheduling to make sure that they have a copy of the card. And if that's on the phone, obviously they'll have to bring that in, or if it's something that they can scan into the office. But having the front and back of the cards, of all of the cards. So if the individual has no idea what coverage they have and they have 5 cards, take all the cards. And then that way you can look, you can call. Again, portal access is great, but sometimes it's high level. So depending upon the type of service, obviously in this case, ABA, you may need to call to really get down into the very detailed levels of their service plan. Because again, just because let's just say Highmark will cover it, that doesn't mean Aetna covers it, and every individual plan is different. So I would say, Matt, back to the beginning of your question, starting on a Medicaid portal or any type of portal that you have access to that's foundational. Medicaid seems to be probably the place that I would start, but again, that's not going to be the be all end all. You're going to have to do your research.
And with that too, I agree with you 100%, Heather, on the Medicaid portal, because even the provider portal, so there are some large portals that a lot of providers use. Sometimes they're inaccurate. So you can go into that provider portal and it will say a child is active, and you will go on to the main Medicaid and you'll see that the access has stopped. So it's really important to make sure that you have a good process and checks and balances, because it can be incorrect on some of the actual provider portals.
And also, when you log on to portals, grabbing screenshots is also important. In many EMRs, you can upload that screenshot into some data component within the EMR. Having that is a good reference too, because 6 months from now, when you have denials or you have problems with frequency, you exceeded an authorization, it's good to go back to your foundational piece. Where did I get this information? Who did I speak with? And again, you might not get that from a portal, but when you do speak with someone, it's good to notate that in the patient's account. And then that way you're able to reference it.
The one piece I'll add on here is, as we mentioned in the first session that we did, we work with a lot of providers all across the country, and I still find it a little bit surprising that there are still providers out there that aren't using a clearinghouse. And I'll recommend, having worked in the clearinghouse business, that number one, there are a lot of them out there, and they are a fantastic way to do some initial verification of insurance benefits. Now, you may not get all the way down to the actual plan level, the benefit level, but at least you can get a yes, no on whether coverage is active for, a particular consumer. So clearinghouses are they're kind of a commodity nowadays. There's a lot of them, and a lot of them do things, a little bit different. And as we mentioned in our first session, when it came to EMRs, I'll say the same thing here. If anyone is ever interested in hearing some of our recommendations around what constitutes a good clearinghouse, we would be happy to share that with you if you just reach out to any of us. So a lot of recommendation around utilizing a clearinghouse. So moving ahead a little bit, as we talked a little bit about this a moment ago, but on the authorization component. So if you have a new consumer that's coming in for care, they have a certain insurance coverage, and the benefit provides for a certain number of units. You can discover that when you're talking to the insurance company over the phone. So how does that utilization of those units work, Rayni? I know this is something that's right in your wheelhouse, but if the insurance company doesn't authorize enough units, or maybe they authorize too many, I mean, what are the circumstances that a practitioner needs to understand as they're managing this part of their business?
So knowing that payers monitor utilization, and also that organization should be monitoring their own utilization, because that can give you a lot of information about which cases you may be having trouble with cancellations, whether it's staff side, whether it's parent side. So it's a really important metric for organizations to have. But one of the things that I always tell people to consider is that if you request a certain number of hours, knowing that a family or child cannot accommodate those hours. So for example, if you request 30 hours, but the family, this child's in school and they're only available, 16 hours a week, you're going to be measured off of the utilization of the authorization. So it starts with thinking about how many hours you're requesting, and really requesting what you're actually going to be utilizing. Or if that changes over time, asking for an adjustment, whether it's in the next auth period or whether you have to do an addendum. So it's important to really have your authorization reflect the hours that you are able to deliver. I think the one offshoot from that is sometimes authorization periods fall over summer. So a kid that may be in school in the summer, those hours may increase, but making sure that that's noted in the authorization, like even asking for 16 hours up until June 30th, with it going to 30 from June 30th to August 15th or whatever it is. So it's really important to just have those accurate hours requested so that you can get measured on accurate utilization.
I want to ask you about that. I'm sorry, before we move on. You mentioned a couple times about getting measured on authorization utilization. What does that mean? And who is measuring?
So it's the payers look at this. So they look at what percentage of utilization that you're using. And typically, I mean, I don't think there's any hard and fast, but I would say most providers, and when we look at this, it's saying 75% and above is where you're hitting, knowing that there's going to be vacations and there's going to be sick time and things like that. So if you are requesting 30 hours for a child and you're only utilizing 30% of that, it's really unlikely that that's going to be authorized again. So even if that's the needed amount of hours, the utilization is really important to show that it's medically necessary and we're delivering this level of service that's medically necessary.
And to add to that, Rayni, not only when requesting units, making sure that you're clear, like you said, whether it's a normal time of year or school year, tracking the units as you provide them as well is extremely critical, because you may use more units than you anticipated. Maybe it's a tougher case, and then you'll run out of units, or maybe you're not using them as much as you thought you would. So definitely tracking your units, which we talked a little bit on the first session about having an EMR track these things for you. Many EMRs, most EMRs should be able to track the units that you've not only requested, but the units that you've received, and then the units that you've utilized. So making sure you're also monitoring that. And then when you come time to get to the end of your authorization period, then you'll know to re-request additional units.
If for some reason the electronic medical record that the provider has purchased doesn't do this, what should they do? Because there are some that don't. I mean, most of them do, you're right. But if they don't, what's a good mechanism for them to make sure they're keeping track of this? Because it is absolutely critical.
I've recommended that they use their reports that come out of their billing system. So you're able to run your claims report or your visits report to be able to see the number of units that you've utilized. So it's not ideal. It's more of a manual process, but you can get the information that way. You just have to make sure that you stay on top of it. The other thing that you just made me think of something else too, Matt. The other thing that you want to know is how the payer expects you to utilize the auth units. So there are some that will say, this is how much you get per week, or they will say, this is how much you get per month, or this is how much you get for the entire auth period. And that's very different because there's some flexibility when you have a monthly authorization or an entire authorization period versus hours per week. So it's really important that you understand that about your payers.
That's very good. I'll just add that both Virtue Healthcare Consulting and ZMark Health have some very good documentation standards around both of these critical pieces of practice management, the insurance and benefit verification, tracking and managing that, as well as authorization management, standard operating procedures that we're happy to share. So just reach out if you want to see any information about that. So the third really, really important component we're going to talk about today is asking consumers or the consumer's family member for money. Because a lot of times when you're dealing with an insurance, a private insurance, there's a copay or deductible. Now, if the individual is dually eligible, they have Medicaid as a secondary, which is often the case. They wouldn't necessarily have to pay out of pocket, but in the situation where that isn't the case, and again, dual eligibles, we could probably do an entire session just on that. But in the event that this individual is covered by one of the large private insurers, they have a benefit plan, they owe copays, deductibles. What are some of the key pieces around that part of practice management?
So I would say that also kind of goes back to the initial intake or the initial paperwork gathering completion. While you're checking benefits, you're obviously getting the information whether they have a secondary. And like we said, a lot of these kids may. And then also understanding what their primary insurance copay responsibility is. Do they have deductibles? Is there co-insurance? Is it specific? Is this considered a specialist? I mean, there's all different levels of things that you need to check for. So making sure that you verify that information up front when you're checking their eligibility is key. Also, we talked about there's probably a lot of paperwork that needs to be filled out, right? So Rayni can talk about the treatment perspective, but then from a more of a billing related perspective, like I said, taking screenshots of portals and doing all those things. Something else that we recommend is a payment policy. And if you go to your own doctor, typically you sign those along with HIPAA. And that would outline that the parents are responsible for anything that is not paid after it processes through the insurance. Again, if there's a secondary, it might be a little bit different, but having that payment policy signed and put into the chart, scanned into the EMR if possible, is important. That's the patient or their parent saying, we know that we have a $25 copay. And then I would also make the recommendation that if they are coming in for treatment, when they are graded, you're getting a copy of the card every single appointment. It seems redundant. Maybe if they're seeing 5 days a week, you don't do it every single day, but you do need to get copies of the cards. You need to be rechecking benefits regularly. And as you're doing that and they're there, you need to ask for their copay. And what we try to coach people on is, because asking people for money is not, it's not something that everybody's really good at. People are nervous. It's not, would you like to pay your copay today? It is, how would you like to pay your copay? So changing the language a little bit, offering, hey, we take cash, credit card, check. A lot of places are no longer taking cash, but really having the language of how would you like to make your payment is extremely important, because if you approach the conversation kind of nervous or unsure, they may say, I can't pay it today. And if you do say, how would you like to pay it today? And they can't pay it, typically that's more of an escalated to a clinical conversation, but making sure that the person who's asking for money is confident and they're using the right language is very, very important.
And I would add to that, it is really important to give that information up front so that you're in compliance with the No Surprises Act. So, ensuring that families understand what their responsibility will be. One other thing that I will mention is that a lot of new providers don't know that you can't charge, for the most part, Medicaid clients. So, even talking about late fees and things like that, most Medicaid plans have policies that you cannot charge them for that. So having a payment policy that's for your commercial, that's for your Medicaid, that covers that is really important. When Heather talked about checking the eligibility, this is another place in leaning on either your EHR or your practice management system. There are some that will do automatic eligibility checks within them, or there are some that you can do manual checks as they come in. So that's something that's really important, especially for places that don't necessarily have a front office. So if your practice is maybe providing in-home and they're not coming into an office, or it's just a very small practice and your clinicians are greeting the families as they come in, really thinking about what your workflow for collections is. So a lot of the times places will say, I don't want my RBTs collecting co-payments. That's not the best practice. So are families going to be invoiced? How is that going to be handled? Will they have a credit card on file? For clinics, I've had places that have a mobile credit card scanner, so that the lead clinicians on site can take that payment, and then everything goes into the system and they don't have to touch anything else. So it's really thinking through, how is that going to work for you, and explaining to families on what to expect.
No, that's very good. Some of the organizations that we encounter in our business, they manage this piece of their business very, very well. I'm a big proponent of it's hard to make your financial numbers. It's hard to make your projections and things if you're not effectively capturing this piece, right? Because so many plans nowadays are very, very high deductible plans, which means the insurance isn't going to pay a nickel until the deductible has been met, and that deductible comes out of the member's pocket. And if you're doing this very well as an organization, one of the things I see these companies doing is, as Heather noted earlier, it's asking, how do you want to do this? And that's one of the first things that, if you're doing sort of an over the phone intake, gathering some initial information, you can ask for the copay for the first appointment at that time. We see it a lot now. Again, you want to create a consumer-centric policy. We certainly have samples of those. We'd love to share. We help organizations, all of us, set this kind of policy up, which is very, very important. But one thing I'll add is, make sure that if you are accepting credit cards from a consumer or consumer family member, that you're using one of the many, many tools out there to manage this for you, right? the concept of writing down credit card numbers in a notebook and charging them every month is very dangerous. There are so many tools out there nowadays. Many of the EMRs have these tools embedded in them, and they cover the PCI compliance, which is very important when it comes to credit cards. So just investigate that a little bit. Again, as with clearinghouses and things, if you want some recommendations on those, we have a lot of that as well that we can give you some insights on, because it is very important. You don't want to put yourself from a business standpoint at risk by having someone's credit card number misplaced and then stolen accidentally. So we certainly want that as well. Okay, so we have hit on some very important topics today. We've kind of just scratched the surface of many of the important components of practice management that are out there. We would love to share more on this. There is so much that goes into this phase of billing, and by setting all of these things up right, as we're hoping that you'll do, you'll avoid pitfalls in billing for these for the valuable services that are being provided. So I'm going to real quick just share our contact information again here at the very end. We welcome any and all questions that you have on this topic. We'd love to share more. So again, any final thoughts you guys want to add?
No, I think so.
I think what we've been saying is preparation is key, really thinking through all of these things and being ready for it until you're in the midst of it, before you're in the midst of it.
Exactly right. So we have a third session that we're going to do, which is related to some of the transactional work around billing and collections. We'll have that out in the next few weeks. But until that time, we hope you found this insightful. And again, we'd love to hear from you. If you have any questions, anything you'd like help with, please reach out to us. We'd love to help you. Okay. Thank you very much.